Topical peptides and growth factors are all the craze right now for aesthetics, and this may be one reason why. It's Dr. Debra Durst, and welcome to the channel. I specialize in regenerative medicine, hormones, sexual wellness, and today we have a focus in on aesthetics, regenerative aesthetics. So that's where things should have been moving. We've been doing that for greater than 5 years, but are now moving, it seems to, in the aesthetic world, is that we're looking at how to regenerate. So instead of just filling, which there's a place for that in aesthetics, there's volume replacement, and then there's muscle movement we want to control, but a lot of it's geared towards collagen and elastin stimulation. And what we want to talk about is a topical peptide, or GHK-Cu, which can be used from a regenerative aesthetic standpoint and is fabulous for collagen stimulation and improving blood flow to the skin and activating those fibroblasts. And so what we have formulated at RevitalyzeMD is a special cream that has a few different ingredients to be exact, and GHK-Cu is the focus. So that topical peptide is great at penetrating skin, and it communicates with the fibroblasts that are making collagen. And that is important because we have about 1% of collagen loss a year, and definitely over the age of 30. So if you haven't done anything to stimulate collagen by the age of 50, you're 50% down. And so we want to do something. And again, good skincare products, some peptides topically, lasers, some regenerative injectable procedures that might include blood products or PRP, and put together with biostimulatory fillers that are really going to stimulate collagen elastin. But this GHK-Cu is one of the ingredients in our RMD cream that, when used topically, penetrates the skin and stimulates collagen and elastin. And so you have increased thickness, increased blood flow, and healthier skin. Then we have DMAE, which is the second ingredient in the RMD skincare. And it's an antioxidant, so it works for cell protection along with the GHK-Cu for cell protection. And then the third ingredient is hyaluronic acid, or HA. And this has a really good concentrated equivalent to the HA products in professional or medical grade skincare lines. But HAs help draw water into, and so it hydrates the skin and keeps that hyaluronic acid in the skin, drawing in the fluid and plumping up the skin. And so that's great for use for just overall skin rejuvenation. And then estriol. This is the fourth and secret ingredient because estrogen skincare is now kind of becoming a little more mainstream. But that estriol is the glow of pregnancy. Whether it's estriol, whether it's estradiol, either one of those used topically increase the thickness of the skin, stimulate collagen, elastin, hydrate the skin. And so it has all the skin benefits as well. So if you can combine all four of those products where you have GHK-Cu and all the benefits, DMAE as an antioxidant, HA for plumping and hydrating the skin, and then estriol for also just thickening everything up and giving you that glow. If you use that skincare once to twice daily, morning and night, you will see amazing transformation in your skin. Again, if you have any other questions, just know I love GHK-Cu as an aesthetic topical peptide for aesthetics and beautifying your skin. So let me know what you think. Let me know if you've had any experience with it. Look forward to starting a conversation in the comments.